Dr. Pauline Foster, the councillor for the Ulster Spring Division in South Trelawny. Well, one of the major challenges is that we don't have a hospital. Everything is handled by the clinics. The hospitals are at least an hour away, one in Spalding and one in Falmouth. We have gotten assurances from the Minister of Health that the Ulster Spring Clinic, which was formerly a hospital, will become a center of excellence very shortly, as you see it's under renovation now, where urgent care can happen, and there will be a doctor here 24 hours for emergencies. Every time the clinic opens, it is overburdened. There are at least a couple hundred people a day who come. Some cannot be seen because there are a limited amount of doctors, sometimes 2 doctors. And even though they work from the clinic opens until it closes, it is impossible to see so many patients. The hope of the persons in this area, in South Trelawny, is that the area gets a full-fledged hospital once again. I also hope that, but I'm not sure if it is going to happen. But the Center of Excellence is going to bring this care just a step below a full-fledged hospital. Because what's going to happen when that starts is that there will be doctors here 7 days a week. It will be open 24 hours a day. And people will be able to be stabilized here, that in cases of emergency or somebody gets sick at night, they can stay here. If it is in the daytime, the people can look to see if they can be stabilized before moving them, or if it's something that just needs overnight observation. So it will be a big step in the right direction, and we will continue not just hoping, but continue working towards seeing if we can get the hospital back. To me, JAHJAH Foundation and the work that it is doing is second to none, in that this foundation, along with others that have come in to the Ulster Spring Division and in other areas of the island, the role that they play is invaluable, because sometimes they do minor surgeries, dental work, they do sonograms, they fill a role, especially where there is a clinic that the clinic cannot do. And it is without cost. You know, I shouldn't say it is without cost, because whatever foundation it is, whether it's JAHJAH or the others, they bear the brunt of the cost. So, and it is not, what I should have said, it's not passed on to those whom they serve. And we are so grateful for that, because the truth is the Jamaican healthcare system right now is overburdened. It's burdened. It's bursting at its seams, and it has a hard time providing the care that persons need. I am so thankful that Jamaicans in the diaspora give back, because without them giving back and paying it forward, persons in these small districts would not get some of the quality care. And for that, we are eternally grateful to the diaspora and foundations like the JAHJAH Foundation.